A physician who studied air quality near natural gas fracking wells and compressor stations believes stricter regulations are needed to protect the public's health. I'm Larry Sauter. Dr. David Carpenter is the director of the Department of Health and the Environment at the New York State University at Albany. He's reviewed air quality studies in 5 states where hydrofracking is taking place and called for stricter regulations at natural gas drilling sites and compressor stations to decrease air pollution from drilling activities.
I'm not opposed to fracking per se. I'm only opposed to fracking if it's done in a way that's not safe to human health.
While Dr. Carpenter is concerned about the health implications of air pollution caused by drilling and compressor stations, he's not concerned about the natural gas people use to heat their homes or cook their food.
If you turn your burner on and don't light it, everybody will fairly quickly smell gas. And if you don't turn it off, there's a danger your home will explode.
The use of natural gas in a home is safe unless you leave your burner on unlit or there's a leak.
And if there's a leak, then you have a facility, or you have the same situation that you have of these people that live around these fracking sites, and especially the compressor stations, because the natural gas is going into the air. The natural gas certainly contains methane. That's the major ingredient, and that's what's burned. But it also contains benzene, a known human carcinogen. It contains hydrogen sulfide, which is the chemical that smells like rotten eggs that has very dangerous effects on brain function. And that's not surprising because natural gas is formed by the decay of organic material, and another product is hydrogen sulfide.
Other ways of heating our homes can also cause air pollution. Wood, for example.
Heating your home with wood is going to cause indoor air pollution that's very dangerous. You're not going to get that if you're heating your home with natural gas under usual circumstances.
Dr. Carpenter makes this distinction between the pollution caused by wood and the pollution caused by drilling activity.
The difference, though, is that people make a choice whether they're going to heat their home with wood or not. These fracking sites are being placed in areas near residents where people have no choice about it at all. It isn't the indoor pollution so much as the whole of the outdoor.
Dr. Carpenter has an additional possible concern about natural gas.
Natural gas, especially that from the Marcellus Shale, which we have in Pennsylvania and New York, tends to have high levels of radioactivity. And that comes from the radium that's in the rock in the deep ground where the natural gas is formed. Radium, unlike uranium and thorium, is quite water-soluble. So when you inject this water in order to cause the fracking, some of the radium gets dissolved in that water, and it's in the flowback water that comes out. But also, radium decays to radon gas. And so natural gas, as it's pumped out of the ground, is going to contain significant levels of radon if it's one of those areas. And it's not every area, but some rock formations have high levels of radium and others have lower. Just as some houses will have radon problems in their basement and the house a mile away will not.
Radon gas is very dangerous, but it has a very short half-life of only 3.8 days.
There has been some concerns suggested that if Pennsylvania natural gas is rapidly pumped into Manhattan, people are going to be burning natural gas and they'll get radon into their home. But unless it's rapidly transported from the field, that's probably not a great threat.
It's easy to use a radon kit to test for radon and take remedial action if necessary.
Yeah, that's true, but the only thing is most people put their radon kits in the basement because of the radon seeping up from the soil, and rarely will one put it in the kitchen.
As a medical doctor who specializes in environmental health, Carpenter believes physicians need to know what's happening where their patients live.
Because the symptoms that people have are usually rather nonspecific. Headaches particularly. Headaches very common. A lot of respiratory infections. They get wheezes. They get asthma attacks. They get respiratory infections. And, most physicians, unless they are sensitized to the issue of these chemicals that are being released, their first thought would not be that there's a compressor station nearby or a fracking well nearby.
Although the evidence is still skimpy, Dr. Carpenter says the studies he's reviewed suggest these symptoms are more common where wells have been drilled and compressor stations constructed. For WPEL, I'm Larry Sauter.